for two reasons. Number one, she calls, even though she's blonde, Dutch lady, she calls him her son, and he sort of calls her mother. She really loves him. But most of all, for the second reason, is that Janie is a severe arthritis, but you would never know it. I've known her for 25 years, and I saw her progress into being a very vital person, to somebody that would have to take 4 aspirin a half hour before she wanted to walk downstairs in the morning. Her arthritis was that severe. She went to Mayo Clinic, and they told her that she would have to take cortisone because she was in such severe pain. And being an indomitable spirit, she said there was no way that she was going to take cortisone because she was well aware of the side effects. And about that time, her women's club was looking for a project, and through all of that, she found out about nutrition. And so, in about summer of 1976, Janie started helping her arthritis through nutrition. Since her husband was a dentist and she had been on a National Dental Auxiliary Board for nutrition and dentistry, she knew a little bit about it. And she had been trying various ways but hadn't really hit the key. So by the fall of 76, when Jamie first started trying to convince me that there was a possibility that nutrition had a role in our life, she was really, she started to come out of it and was feeling so very much better. In this much time, Jamie has gone off of nutrition 4 times. She says the first week, she feels okay. By the second week, she's hurting a little bit. And by the third, got things in control. Now, EWA passed, and I felt this hotel passed. And whenever one tried to get a hold of Jamie, she was off somewhere. She just got back from Scandinavia, and now she's on a 4-day convention. So, through supplements and proper nutrition and taking care of yourself, Dr. Nasr, please come and tell us about it.
Thank you. Thank you very much. Thank you. Good evening. Well, this topic tonight about arthritis is probably one of the most exciting topics when it comes to correlate nutrition to arthritis. First of all, because you all know arthritis affects every one of us, contrary to cancer or heart disease or other diseases that some people have it, some people don't. Everyone will develop arthritis. Number 2, many times the word arthritis itself is misused, and the person really does not have arthritis, thinks they have arthritis, and they have different diseases. And it is very important to get the proper diagnosis and the proper symptom so you can get on the right track. The other thing about arthritis, it is many times when you, especially if your body is doing very well and your heart is doing very well and your brain is doing very well, but your joints are not doing very well, it gets very frustrating to the individual. They're capable of thinking, capable of doing all kinds of things, but they're not capable of moving and reaching. And that itself is agony, because these people, most of the time, they are very intelligent and they are not depending on anybody else. They don't want anybody else to help them except they want to do it themselves. I started getting interested in arthritis probably around 25 years ago. During that time, I have just gone to Cairo University, and my mother started having symptoms of arthritis. And this is probably one of the earliest stories I told in nutrition about 20 years ago when I came to this country in 1968. So it's approximately 20 years ago, 20 years ago. And during that time, before that time, I went to a school agriculture school, biochemistry school, and I have a brother, twin brother. He went to medical school. My mother, during that time, started developing some arthritis, and she started taking aspirin, anacin, aspirin, all kind of pain medications. Pretty soon, one pill was not enough, then 2, then 4, then 6, then 8, and so on. And she started having more problems, not only from the arthritis, she started having more problems from the side effects of the medication. And they start having bleeding ulcer, and then having bleeding ulcer, then you develop anemia. Then anemia, you develop tiredness and fatigue. Now, instead of just having arthritis, having tired and fatigue and anemia and weakness, and you get in that vicious cycle, and the human body, one of the human body is put in a way that you make one organ weak, the others start falling apart. Pretty soon, of course, with anemia, the heart has to start compensating, because the heart is the first organ to compensate when you have anemia. That heart has to pump so much blood to the brain and the rest of the body, and if you have half of the amount of the blood available, that heart has to double its speed to compensate. Are you following me or not? And when the heart does that, it gets in trouble by going so fast for so long. It gets weaker and tired. And then when it gets weaker and tired, the amount of blood coming out, it goes low. Then the brain starts suffering. Then the kidney starts suffering. Then the arthritis starts getting worse, and so on. Then I start, during that time, by the second or third year of my study in biochemistry and nutrition, I started interfering a little bit of the therapy she was on. I started learning more about the human body. I started learning more how God put this nature together. And I started arguing with my brother. I said, I think maybe there is healing in nature that you are missing. Maybe diet has something to do with it. Maybe there is other things, not just medication is the only thing. Maybe there are other things we should use. Well, of course, like most of physicians, they learn in medical school there is nothing else except the medication or surgery. Diet is not important. Then he started saying, no, this is not, there's nothing else going to help. Well, I started interfering when she started having hepatitis, and from too much bleeding, and just when you see somebody going downhill very fast, she was one of those people. Started changing her diet, changing the way she does things. By about 3-4 years later, she had no arthritis, and she had no more pain. She doesn't have to take any more, aspirins and any of that stuff that much. Maybe once in a while she take 1 or 2. I came here during that time, and I started continuing to send her food supplements to take from United States. It happened to be Shackley products I was sending that time. And I still continue to send it to my father because my mother passed away a few years ago. When her ulcer acted up all of a sudden and she started bleeding and nobody can stop it, and she just bled to death. But during the period of 17 years I was keeping her going, she was taking her food supplements until about 5 years ago when a doctor in Saudi Arabia, where they were living that time, happened to be American doctor, told her these supplements have no place in your life and you're wasting your time and you're too old to take this stuff. This is your Motrin and this is your medication. And I went there and she wouldn't listen to me. She was listening more to him. And she had a bleeding ulcer that would not stop and died from that. The thing I learned that time that diet definitely is very, very important. And my father realized that, and he was here in the hospital in Milwaukee last year, and lots of you remember. He had a massive heart attack when he came to the United States and was in a coma for a long period of time in the hospital. Was paralyzed, had strokes and all kinds of problems. And when the hospital called me, St. Luke's here and say, do you want us to code him? Means if he died, do you want us to call a code just to let him go? And that time I decided to transfer him by ambulance to my house, where I had my brother take care of him. And that was around, I think, January this year. And then by April, he walked to the airport and he walked back where he came from by himself. And ate by himself, talked, did everything with a cane a little bit, but he was able to do it. How we did it? They believe in God, of course, and believe in diet. He believed in it, and he did everything we want him to do. The nutrition played the whole role. Not some role, the whole role was nutrition. I got a chance to watch him when he's coming out of a coma and stroke and all of that, to see what is the first thing he's going to want, And the first thing was vegetables and vitamins. He was not craving meat, he was not craving cheese, he wasn't craving milk, and we had just nothing but vegetables. And I have a horse farm, I took him to visit the farm before he left the country, and he saw alfalfa, and he just grabbed a handful of alfalfa and started eating it off the field, which belonged to horses. But I started laughing, and he started giving me a lesson not to ever laugh like that again. And he said, well, this is how I did it all my life, and there is nothing wrong with that. Thinking about it, it is whenever you seek nature's way to heal a disease, always nature responds. Whenever you take man to help a disease, always man fails or screw up someplace. Because it is, if any doubt, you go back to nature, see how nature does things. And just follow it, and you'll find everything is done for millions of years very well and very well organized in a better way than we human beings can ever do. When we go to arthritis, probably the most important thing I like to say about arthritis, as you already all know, I prepare my lectures in the last minute, so I went to the bathroom. I just prepared what I'm going to talk about right now. And that's true. I made a small summary in 1 hour, give you some idea of what is arthritis, what causes arthritis, what are the symptoms of arthritis, how to treat arthritis with medicine and nutrition. And if I can do that about all arthritis in 1 hour, that would be great. I think I can. First of all, the word arthritis itself, it is arthra and then itis. 2 words. The word arthra in Latin means what? Means a joint. Itis means pain. Means pain in the joint. So when the word arthritis itself, it's a symptom. It is not a disease. It is not a diagnosis. When somebody tell you, I have arthritis, or you have arthritis, just like saying, I have a headache, headache, pain in the head, stomach ache, pain in the stomach. It doesn't mean anything. It doesn't mean, the word arthritis then doesn't mean anything. It doesn't mean what caused it. It means there is a pain in the joint. That pain can be caused by the disease we used to call arthritis, or it can be caused by anything else. If you have a nail in the joint, you have arthritis. If you've broken a joint, that's arthritis. It's a pain in the joint. So you understand the word arthritis itself, if anybody use it, just tell you, take this for arthritis, that itself is misleading, because arthritis itself is a symptom, which a symptom can be caused by many causes. And we have to know the cause of a symptom to cure a symptom. You understand or not? Somebody has a headache. Tell you, I got a headache. Well, fine. It could be sinus. It could be tension headache. It could be broken neck. It could be stroke. It could be aneurysm. It could be high blood pressure. It could be eye problem, ear problem. You follow me? So you can't go to somebody who's saying, I have a headache, tell him, take this. You've got to know what is causing the headache, what disease caused it before you treat it. And the treatment, of course, is medication, it's necessary, and nutrition, and all of these things we're going to be talking about. So one of the most important things in arthritis to understand that there is no such thing called disease called arthritis. there is a symptom called arthritis. If this is arthra, means the joint, and itis means pain in the joint, I will show you how many joints the human body has. First of all, we have a piece of bone on the head called the skull. It's one piece connected to many pieces of bones, one after the other, called what? The vertebral column. This is not the right number, but there is no more space. This right here connects to a bone like this, called the what? The pelvis, which in the back of it extends down to the tailbone in the back, and in the front the pubic bone, and the rest of the stuff sits in the middle, right here. There's a socket right here and right here where the legs connect. And we continue with that. There is a joint here where two pieces of bone connect right here. And then we go further down. I made it too big. It should be all on one page. But anyway, it comes down like this to few bones called what? The feet. And they are looking like this because there's so many of them. This is all joints, right here and here and here, and the knee right here and the hips right here. And then we go, the vertebrae, all joints, and then there is a piece of bone right here, and with a socket connect to two pieces of bones, and then the same thing right here called a hand. So the body is made of joints, and a pain in any of these joints will aggravate that person. So a pain in that joint right here will give you a headache, and it is arthritis. A pain in the shoulder, it gives you a pain in that shoulder, it's still arthritis. Pain in the back is still arthritis. Inflammation of the joint, or pain in the joint, pain in the hips, arthritis. Pain in the knees, arthritis. So the word arthritis means pain in the joint. It is worth it then to take any of the joints and magnify it and look how God made a joint. And if we understand how He made it, maybe we can understand how can we heal it. You understand or no? Because all joints are made the same way almost. These joints, as you can see, there is over 100 joints in the body. Because there is over 100 joints in the body, and joints are pieces of bone connected to each other. Those bones connected to each other, if you want to separate them and put them together, they have to be insulated from each other so they don't touch each other. You follow me or no? Because you can imagine 100 joints, bones, touching each other, and you're walking down the street and all these bones touching each other, it creates lots of headaches and noise. So they are separate. You move them and then you don't have the sound. Once you start having sounds in them, this means they are touching each other, and this means there is something wrong. There is something wrong in the joint. It is arthritis. But what kind of arthritis? What caused the arthritis is the important factor. Unless we know what causes the problem, we never can improve or heal any problem. A joint, let's take, for example, let's take a knee right here, or a hand, or an elbow. It's one piece of bone connected to another piece of bone with a space in between. You understand that or not? This here is a bone. This here is a bone. These bones, they have a layer of a very soft material so they don't rub against each other, called the what? Cartilage. So if they touch, they don't scratch each other. So there is a bone and there is a cartilage. Between the space right here, what's in it then? Is it air or is a fluid? Fluid. There is something here called what? We call it synovial fluid. There's a fluid. It has to be a fluid. Is this fluid watery or viscous? What it should be. If you're making a joint yourself, how would you make it? Would you make it nice and viscous so it's lubricated, or you make it watery? You make it viscous. So it is a viscous fluid. And then the space between them is the space should be according to how big is the joint, or it's the same space between all joints. It's according to the joint. So if we have a knee, we have a nice space. If we have the vertebra, we have nice big space that the disc, called the disc, and if we lose that, we have problem. Now we have fingers. There's not much pressure on the finger. We don't walk on them. So the spaces are very little or tiny. If we look at a piece of bone like this, making a finger, and this is the nail right here, and you find out that this finger right here has space. That's not as much as the knee or the hip, because there is not as much weight going to be on it. So the joint is made scientifically. This fluid, should it be loose or should be capsulated, closed in? We should close it in, because you can imagine a person like this walking with all the fluids leaking. You're going to have bulges here, bulges there, and it's not going to do the job, so we should close the joint. So let us close the joint. What should we close the joint with? Should we close it with the same material which covering the bone, or should we close it with meat? It should be something similar to not meat. It should be cartilage. It should be something that white meat, you see, that it is strong, that it can hold the joint together. So there is a cartilage right here. Well, you can imagine that is a cartilage and this is two pieces of bone. They're not strong to withstand that body and make it stand still. So what do we have around the body to keep it stand still? We have, what do we have here? Muscles, exactly. You got to have something to hold it together, and those are the muscles. This is the joint. Anything that's going to create weakness in the joint, it has to be some problem here. You follow me or not? Easy to understand. If you look at this in front of you, which one of those things you see, the bone, the cartilage, the fluid, and the muscle, carry the weight the most? Which one of those things carry your weight the most? Keep you up, free of pain? No, the muscle. The muscle is the one, number one. It takes the weight of everything. The muscle connects to each other, and when you see those Russian weightlifters or those big weightlifters lifting 500 pounds, 250 pounds on each joint, don't ever dream that this fluid has 250 pounds of pressure. The weight is going through the muscle. And their back, the cords of the back right there, those muscles is like hydraulic lifters full of blood, and you cannot bend fluid. Fluid, when you compress it, it can push hydraulic jacks, it can push 20 tons in the air, it can do anything. You know, fluid cannot be compressed. So muscles get bigger and bigger and bigger, and they get full of blood. Once they get their blood, you cannot compress blood. So they stay and they support their body. So the first lesson we learn if we want to help a joint is to help what? Muscle. You've got to build the muscle around the joint. Without it, all your efforts will fail. Doesn't matter what arthritis you're talking about. Back pain. It is true you have a disc problem. It is true it's compressing the nerve. It is true you need surgery. You need papaya. You need medication. You need rest. You need all of that. Build the muscle, and you will see those two muscles in the back and the two on the front. Just they push like this, and they separate the back from each other, and no more pain. You understand or not? So exercise becomes extremely important. Next lecture, I just told Joyce, I think we should talk about exercise and proper exercise and fitness next time, how to improve the circulation to the brain, to the heart, to the legs, to all of that in another lecture. This here in front of you, everything about the joints. If we have a problem, here we're going to get a little bit deeper in medicine now, in diagnosis. All the pain here you see in front of you called arthritis. It could be in your muscle, still we call it arthritis. Wrong, but we call it arthritis. It can be in the bone itself, which is nothing to do with the joint, like osteoporosis, we still call it arthritis. That's how medicine classified, and we must leave it that way. If the pain is in the bone itself, that's number one disease right here, we call it osteoarthritis. Because the word osteo means what? Means a bone. Osteoarthritis. So now we're leaving the word arthritis to go more intelligent way of diagnosis. I have pain in my joint. What is it? Is it osteoarthritis or is it something else? Unless I know that, I'm not going to be able to heal the problem. And osteoarthritis occurs when the two pieces of bone touch each other and they start growing and making spurs that is pinching nerves and pinching other muscles around them. This is what we call aging arthritis. This is what we call overuse arthritis. This has happened mostly in the joints that's used the most. So where do you see osteoarthritis the most then? You're going to see it. It depends on your profession. Football players, where are you going to see arthritis in? You're going to see it in the knees, the ankles, and sometimes the back. How about joggers? Where are you going to see it? You're going to see it in the hips, the knees, and the ankles. How about wrestlers? You're going to see it in the shoulders. How about bricklayers? The knees. So it is an overuse type of arthritis, and we call it osteoarthritis. There is no time to get in details on each arthritis. I was thinking when I was coming here, how I'm going to cover rheumatology, which is specialty, takes 3 years after become a doctor, 3 years in 1 hour. But if I explain it simple, you probably can help yourself and help others. Osteoarthritis is degeneration of the bone. How can we help osteoarthritis? We come to that in the end of the lecture. What is the best way to get rid of pain and all of these things? We already talked about the muscle. The other disease, when the bone itself was still in the bone, have holes in it. And these holes in Latin called pores. Pore means a hole. And the disease called osteo, because it's a bone, and the pore means hole, osteoporosis. Means holes in the bone. That is another kind of arthritis number 2. I am taking them according to how often it is in the society, not how serious it is. So number 2 arthritis is holes in the bones, called osteoporosis. Number 3, we must get closer to the joint a little bit. The disease itself, which affects the ligaments around the joints. A ligament arthritis. What do we call that? The word ligament is called rheumatoid. Rheuma means rheumatism, means joint in a way. So that is called rheumatoid arthritis, which affects the lining of the joint. And a disease on that causes the joint itself, the collagen itself, to swell up and shrink down, but the joint stays still okay most of the time. And the bone around it is still okay. It's just the cartilage itself swells and shrinks and back and forth, and it causes the same thing they all do, which is pain. The more pressure on the joint, the more pain. So most of the time, your biggest pain is rheumatoid arthritis because that causes the most pressure. And that's probably the hardest type of arthritis to try to improve. Then we have arthritis when we have a problem in the fluid. We call that fluid arthritis or gout arthritis. So gout is inside right here when we have uric acid crystals. The last disease of arthritic is a muscle arthritis, when you have aches in the muscle itself surrounding the joint. It can be from anything. It can be the muscle is diseased by a virus infection. When you have a cold or flu, you feel these aches, like a rheumatic fever. It could be that there is lupus, autoimmune disease. It could be anything that's irritating the muscle itself, lack of calcium, lack of potassium, lack of blood supply. So that's also another arthritis. That's polymyalgia rheumatica or autoimmune disease, or whatever we call it, it is a muscle disease that it is causing arthritis. So when we have a title in the lecture saying arthritis, that means anything that surrounds the joints that makes you deformed, disabled, in pain, and your life is getting worse or miserable. This means none of this stuff right here, or most of these things right here, is not serious to kill anybody, like heart disease or cancer, but it is disabling disease that it makes you, your hand is deformed, your body is deformed, you cannot do what you want to do, and that's just as much agony as a guy who has angina pectoris or a stroke. Just the fact that you cannot reach the light bulb so you turn the lights off itself is a problem. We should speak about each one of these arthritic for a while. When we talk about osteoarthritis or any of the arthritic condition, I like to speak about the symptoms. What symptom does it give you, each one of those? How the diagnosis is made, how to be sure that which one is which, and then the treatment, what to do about it medically or nutritionally. Okay, are you following me so far or no? Let's take osteoarthritis first. Osteoarthritis is a disease that affects the joints all over the body, that the joint gets old and then they start having sperm form in the back. When the spurs, you know what the spur mean, right? Just like arrow, they start growing out of the bone, they start pinching these what? These nerves coming, and once they pinch the nerve in one side, let's say the neck, you move yourself in the wrong position all of a sudden, and the pain comes down the arm. It seems like a heart attack. And the good doctor or emergency room doctor has to be sure it's not a heart attack first before he assumes it is arthritis. And chiropractors, all of them doing a good job with that, but they have to be sure it is not a heart attack first before they assume it is a pinched nerve. Because it's the same nerve carrying the pain to the arm from the heart, and the neck is the same nerve. And many times it is the heart and you don't know. So this pinched nerve, it causes pain, and the pain is osteoarthritis. What can we do about if I am the patient and I have my joints all full of spurs, and you're the doctor and I'm coming to you, all cannot walk, what is the best approach to that? First of all, any approach to any disease has to be made in 4 different ways. How to treat osteoarthritis. First of all, a diagnosis has to be made. You come to the doctor and the doctor says, what's your problem? My problem is a pain in the neck or pain in the back or pain in the hip or pain. Then x-rays has to be done. And a physical examination has to be complete. And after this has been established, that definitely is the bone causing it, not a cancer, pinching a nerve, not the heart, not circulation, not a blood clot, none of this stuff is serious, then the treatment coming right here. First thing in treatment has to be get rid of the pain. The pain is number one enemy to the joint. Because the more pain a joint develops, the more swelling it gets. The more swelling, the worse it heals. So the pain medications are very important to take if the pain is intolerable. You follow me? It does not make any sense to be in pain for any disease, because pain itself is very destructive to the body. You got to get rid of the pain. There are ways to get rid of the pain. Doesn't have to take a drug to get rid of the pain. Some people use heat pads. Some people use cold packs. Some people take lots of calcium. It works on them. Some people might take some Tylenol or aspirin. But you got to get rid of the pain so the swelling is not as bad. You understand or not? Here we are tonight. We believe in nutrition. It is true. But let us be realistic. A person who has a broken bone who comes to me and I tell him, go take some vitamins for your broken bone, he's going to laugh at me. He's in pain. He needs to be x-rayed. He needs the cast. He needs the pain medication. Then I can tell him tomorrow take some vitamins. But first day when he broke it, that's all he want to do is get rid of the pain. So realistically, arthritic patient has to have something to get rid of the pain. Manipulation by chiropractor. If it does the job, better than drugs by all means. Heat pads. Any way to get rid of the pain is number one. Number two is diet. Is diet important for osteoarthritis? Can diet help against osteoarthritis? Well, if you look at the joints again, you realize something very important. The further we can separate these from touching each other, the better it is. That's why we said exercise is very important. This fluid, when we take a sample of the fluid in an osteoarthritic patient, normal fluid will have will be thick, viscous, white, crystal, clear. That's a normal fluid. When we take a sample from arthritic patient, we find it watery, turbid, no viscosity, just water. When we analyze this fluid, we find lots of hyaluronic acid, which is a fancy name I'm throwing in right now, in plain English, vitamin C. Hyaluronic acid is made of vitamin C. So the substance in the fluid itself is nutrition, is a nutrient. There are nutrients in that fluid that makes it like that. If we look at this fluid here, and we have somebody have less fluid in the joint, that person has to have the exercise to the joint to get rid of the pain, get rid of inflammation of the joint, but the most important thing, has to build the fluid back. Can a joint that it is collapsing joint build back? Yes. Build the muscle with exercise. Take the proper supplementation. What is the proper supplement for arthritis? Do you believe there is a special diet then for arthritis, or just good diet is good for all arthritic patients? After we talked for a while right now, what is your feeling about diet? No, there is not. No, there is not. There is no specific diet for specific arthritis. None. It is the good diet you're going to follow for your heart, your diabetes, your hypoglycemia, your cancer. It works on all of them. There is no magic. There is no such thing called a diet for a specific thing. We don't have anything in the record to show that specific diet is good for a specific disease like arthritis, especially arthritis is a mini disease. So, just like I said in previous lectures, you don't have to, when you have a disease like osteoarthritis or osteoporosis or gout or rheumatoid arthritis or autoimmune disease like multiple sclerosis, any of that, you don't have to look for a specific diet because you're not going to find it. It is the common sense diet we talked about for the last 5 lectures that works. It's the same one for all of them. And anybody who prints a book says the diet for arthritis, the diet for this, is nothing except to sell a product. Because we know, definitely, that diet is extremely important for healing the body for any disease. It doesn't have to be only arthritis. It could be any disease. You follow me or not? So there is no reason to go to somebody who has arthritis and say, well, you've got to be on this or that. He has to be regardless if he likes it or not. Because if he does have arthritis or inflammation of the joint, he probably has lots of other diseases with it. So there is no reason for that person to have an scapegoat and say, okay, I am on the diet now. I don't have to do anything else. The diet's going to do it. There is no such thing. A good diet, like we said in the last 5 lectures, are a diet that has a good protein, good carbohydrate, good fat, plenty of water, minerals, vitamins, and there is plenty of oxygen going in with that diet. You remember that we talked about several times. Protein, there is animal, and there are vegetables. And we talked about that. Which protein is the best for the body then? Vegetable protein. So, if somebody says, what should I do about my diet and arthritis? Still vegetable protein. What I'm going to do with my heart and diet? Still vegetable protein. What I'm going to do with cancer and diet? Still vegetable protein. There is no reason to make a big thing out of nothing. You understand? There's no reason to create a specialty called nutrition and a special clinics called the nutritional clinic and all of that. It is a simple stuff, and let's not make a big thing out of it. Because it's all in your kitchen, not in the doctor's office. Carbohydrate. I explained to you before, there is no animal and vegetable, but there is sugar or simple, and complex means carbohydrate starches. Which one is better for the body? The complex carbohydrate. So fruits and sugars and fruit juices and sweets are not as good to the body as a piece of bread, potatoes, or French fries. This starches is a lot better than fruit. You follow me? We talked about that before. Remember, it is not what you like is going to be good for you. It is what makes sense scientifically is good for you. And, of course, when I'm hungry and I have a piece of fruit, it's a lot better. I feel a lot better than a piece of bread. Of course, because it has the sugar which is going to make me feel good right away. But which one is really better for my body is the piece of fruit or the piece of bread? Of course, the piece of bread is a lot better. Because it prevents hypoglycemic reaction, as most of you already know. So if we say which diet is good for arthritis, we're still going to say eat lots of starches, eat vegetable protein, lots of that, avoid animal protein, avoid lots of sugars, and right there you achieved very good success in the diet just by doing these 2 things right there. It is hard to do when you go to the store and you see the cakes and chocolates and all of that, and you see the starches. You feel like your body is throwing you, taking you toward that, because the human body has a sneaky way of getting the cheapest source of energy with the least amount of work. It doesn't like to digest a piece of this and this and this. Oh, let's get it over, have a chocolate and an energy bar. The best thing is starches, of course. Then the fat. Is fat important to the body? Of course it is. Fat is the main source of energy, number one. The main source of hormones. All your female hormones and male hormones, adrenal, all of that made of fat. But fat, there are two kinds. There is animal and vegetable fat. There is the oil, which comes from the soybean and the corn and all of these things, and there is the fat which comes from pork and the other group. Which one now, 1987, you think is better for the body? Of course, vegetable fat. We've been saying that for 20 years. Before EPA came up, we were saying take vegetable fat all along. So, vegetable fat. So, which diet is going to be better for arthritic patients or any other patient? Is still the vegetable protein, the complex carbohydrate, and the vegetable fat. People can make things difficult. Somebody asks me how I'm going to have my toast with oil. Well, that's your problem, not my problem. First of all, you don't have to have a toaster with oil at all. You know, I think a piece of bread baked in the oven does not need the oil to improve the taste of it. I think it smells good, tastes good as it is. But because we're accustomed to have oil on, something greasy on it, it doesn't have to be the stuff that it melts. It could be oil that's already melted in the fridge, and you put it and you brush it on. And they do that in big restaurants. When they have the big toaster going, you don't think they get butter and put it in each one. They have the oil, which happen to be better for us than the margarine or the butter. Water, of course, is important for all diseases. Now we're talking about osteoarthritis. We might be talking about immune osteoporosis or gout or rheumatoid arthritis. It's still lots of water in the body. It washes out chemicals out of the body. It is better to drink lots of water than not to drink enough water. Then there is no animal or anything, just good water. When we talk about water, you got to understand there is a difference between Pepsi and Coke and water. Because a Coke is not water. A Coke is water with sugar in it. Or Pepsi is water with sugar in it. Or Diet Coke or Diet Pepsi is water with poison that causes cancer in it. And milk is not milk is not pure water. It's water with protein and carbohydrate and fat in it. Beer is water with alcohol in it. So we're going to have to know what does the body want exactly. It doesn't want other things. They just want water. It is very difficult to teach people who have not even drank water in their life to drink water. There's lots of people when I tell them drink water, they vomit. They say, yuck, I cannot drink water. It becomes a habit and a custom in the society that drinking water is a bad thing for you. The whole thing started in Austria and Germany long time ago. The Germans looked at water as poor people drink. But wine is wealthy people drink. Then in this country, Coca-Cola and Pepsi did a very good job by showing somebody real hot and jumping in the swimming pool. Of course, when you are watching this ad and you're hot, you're going to grab a cold Pepsi. But when you drink a cold Pepsi or a cold beer, and it helps your thirst, actually, it doesn't help the thirst at all. It is the coldness in it that numbs the tongue and makes you feel you got something. You want to prove it? Drink hot beer or hot Coke. So if it is the water making the difference, then it should not make any difference, hot or cold. So it is the coldness making the difference. And that's why we all like it. Because you're hot, you like something cold. But when you are a child raised in America and watching a TV ad telling you if you're thirsty and dying from thirst, don't drink water, then you're not going to drink water. And the TV ad a few years ago was like that. You saw it yourself on TV, right? When the guy was very thirsty, dying, and somebody gave him a glass of cold water, it was cold water even, and he said, no, I don't want that, I want a straw. Remember the ad? So you got to remember the reverse psychology behind advertising and affecting children, you know. So this kid's going to grow, when he's thirsty, he's going to want beer. So it is not the fault of everybody. It is the fault that we need more education and more discipline. Then this is why I mentioned this note right here. On every lecture, I bring it back, and so I keep rubbing them, so maybe somebody will follow it, and maybe they feel good, and then they don't need as many drugs for their arthritis eventually. Minerals are very important to arthritis and any disease, especially calcium and magnesium and alfalfa, which have lots of trace minerals. And we know that animals who eat lots of vegetables have less arthritis. Animals who eat lots of meat products have more arthritis. So we know horses that eat alfalfa have less joint problems. We know dogs that eat human products have more arthritis. This is the way nature is. Animal eating creatures have more joint pains or arthritic conditions than vegetable eating creatures. Vitamins are very important, and there is no specific vitamin for arthritis. You cannot say to an arthritic patient with osteoarthritis that it is a specific vitamin. It's still the A, the B, the C, the D, the E, all of them important. So when we emphasize now the role of diet, I emphasize something that diet apply not only to osteoarthritis, osteoporosis, rheumatoid arthritis, any of them. It just makes sense. That's all. So you have to take care of the pain. You have to take care of the proper diet. Then the other thing which is important in arthritis is exercise versus rest. You got to know when to exercise the joint, when to rest the joint. In osteoarthritis, when you have a back pain, it is very important when it is a swelling and pinching the nerve to rest. You got to rest it. But it is important once you rest that joint and the pain went away, that to start exercising the same joint, because the pain is going to come back again. You understand or not? So a joint is nothing but a space that you have to keep it moving all the time, and the more you exercise the joint, when it is not in pain, the better the joint is going to be later on, and the better the muscles around it will be. This point here we're not going to cover yet this time, because we're going to move to another disease called osteoporosis. Osteoarthritis is the most common arthritic condition in America, and it is probably one of the easiest to prevent, one of the easiest to control using what we talked about. There is another disease called osteoporosis. This when the bones start having many holes in them. What is the bone made of? Mostly calcium. When the bones start having holes in it, this when the bones start getting weaker, we call the disease osteoporosis. If you look at the calcium, how the calcium enters the human body, this is the mouth right here, and this is the stomach, and this is the intestine, the bowels right here. The calcium enters the stomach, it enters the bloodstream, and then goes to the bone. But the calcium you take, it does not enter the body freely. Everyone here knows that calcium is very important against osteoporosis. Calcium does not enter the body unless the body wants it. There is a gland in the neck called what? The thyroid gland. In the back of that thyroid gland, there are 4 glands called what? The parathyroid gland. This parathyroid gland, there is a guy sitting in this gland right here, and he takes samples of the blood and check it for how much calcium, how much phosphorus swimming in the bloodstream. When he noticed that the calcium is low, he called a doorman sitting in the bowel right here, called the vitamin D until vitamin D opened the door, allowed calcium to come in. Now, you took calcium and the calcium went in the bloodstream. That calcium cannot enter the bone unless something takes it in the bone. This is how estrogen becomes very important to carry the calcium to push it inside the bone in these holes right here. So to try to achieve cure for osteoporosis, just taking calcium supplements alone is not going to work. The hormones have to be balanced. The calcium has to be there. The magnesium has to be with the calcium. And also, not very important, the circulation has to be fast through exercise. There is no way you're going to strengthen that bone when you're taking calcium and estrogen but sitting around. So when we talk about osteoporosis, what can we do about osteoporosis? If the osteoporosis causing pain in the joints, and osteoporosis pain is very similar to osteoarthritis. It is also a joint pain. But the biggest difference between osteoarthritis and osteoporosis, that osteoporosis, you feel the aches in the bone itself. And then it's not getting better. It's just getting worse and worse and worse. Osteoporosis is a very, very much preventable and curable disease. We have patients in our clinic that have severe osteoporosis, cannot even walk 5 years ago. Right now, we take the x-ray, we very hardly find any osteoporosis in their body. We have patients, we have the complete deformity in some of the joints. And the joints start moving again and start functioning again. Osteoporosis is not a disease just you take calcium for. You got to have the proper diagnosis, and you got to treat it properly, and the diet has to be important. The exercise has to be there, not rest. With osteoporosis, the more exercise, the better for the bone. The biggest problem with osteoporosis, you see it in the United States, you see it in people in women over the age of 70. You find somebody over the age of 70 doing fairly well, all of a sudden they fall. What happened to them? They break what? The hip. I'm going to draw the hip of somebody who is over 70, woman, that just broke her hip, and let me tell me what can we do about it after it broke. This is the pelvis. This is the head of the hip right here, and that is the neck, and that is the big piece of bone, and this is just broken down here, or broke here in the neck itself. The bone is not a normal looking bone anymore. The bone has lots of what in it? Lots of holes. That's why it broke. What can we do about that bone? Can you pin osteoporotic bone? That's right. It shatters. You put a pin, it breaks. You put a pin, it breaks. Then what can we do with that person after you pin it and pin it? It doesn't work. You replace the hip, but how can you replace the hip? Here is the new hip right here. This is the new hip. You got the head, the new head right there. But you have a pin, and you got to put it in this bone. So how can you pin it, even you put an artificial head when the bone have holes in it? You follow me or not? Then what happened to that person? It's in the hospital for a month, 2, 3, 4 months. Then what happened after that? Go to nursing home. That's it. And during the process, the person is awake, alert, conscious, oriented, the brain is fine, then they have a blood clot, and they have pneumonia, or they have heart attack, and they die. Or they go to nursing home with a stroke from the blood clot. Because laying down with a broken head, you're not exercising. When you're not exercising, you're going to have blood clots. When you have blood clots, you cannot breathe, and you have a stroke. You follow me how one problem creates another problem? So let us not wait until we have a broken hip. Let us not wait until nursing homes. I don't have any patients in nursing homes, period. Well, let us go ahead and think about osteoporosis as a preventable disease and then go after it. Can osteoporosis present itself as other symptoms besides just pain in the bone itself? Let me explain something to you to show you how complicated human body can be. This is a bone. The bone is developing osteoporosis. What is the function of the bone in the human body? What does it do besides support the body? What does it make? The bone makes what? Makes blood. Okay, you said red. It makes red blood cells. And that person who has osteoporosis, it might not make as much blood as he should be, right? Then that person will develop what disease? Anemia. When he has anemia, what symptom he has? Tired. Here is this person's tired and his diagnosis is osteoporosis. He has anemia, but his diagnosis is osteoporosis. To try to correct the anemia by giving that person iron and B complex, but actually what does that person need? Need more calcium, not iron or vitamin B for his anemia. So it shows you got to treat the root of the problem, not the superficiality of it. But there is another cell the bone makes besides red blood cell. It makes also white blood cell. What does the white blood cell do? It fights disease. So a person who is 60, 70 years of age, who's a woman, who has lots of frequent infections, maybe the immune system, the white blood cells are going down. Then they go to a doctor, you get antibiotics, you get this, you get that. The person might have osteoporosis is the cause of the problem. So when we're dealing with one disease, like osteoporosis, we can have multi-symptoms, not only pain. You might not have any pain yet, but you might have fatigue, tiredness, chest palpitation, chest pain, short of breath, frequent infections, bleeding, because the bone also makes platelets that stops the bleeding, bruising, all of this related to arthritis, which called osteoporosis. The other arthritic condition we should talk about called rheumatoid arthritis. Rheumatoid arthritis is a collagen type of arthritis that it eats through that collagen and the joint swell. Mostly affects the hands and causes deformity in the hands, and the bone looks like this. There's a bone like that. This is the third one right here, and this is the finger right there, and this joint starts to swell, so the person starts having what we call rheumatoid arthritis. Rheumatoid arthritis is a swelling of the capsule itself, and nobody knows why that it happens. We know osteoporosis, I talked about. We know osteoarthritis, we talked about. We don't know what causes rheumatoid arthritis until now. We know it is a poor immune system. Immune system is down. We know that the person who has that disease is open for other immune diseases with it, but we don't know how to heal it. The diet help these patients when I have it in my clinic. When we have almost 99% success with osteoarthritis and osteoporosis, we find that using the proper everything right here, the success rate still 10%. And not only that, it is true that people we have with rheumatoid arthritis doing better, but by no means I consider it success. It's still a mystery. But these people, maybe one day we discover a key to unlock the immune system and help these people. It is the same disease, almost, autoimmune disease, that causes rheumatoid arthritis, causes Alzheimer's, it causes multiple sclerosis, it causes cancer maybe, is related to the same group of diseases, and we still don't know why the immune system turning against itself. What happened with these patients, that's really not arthritis. If I ever find that finger right here. That's not arthritis, actually. What happened in these people is that their own system turn against their own joints and eat it. So it is not a nutrition-related disease, deficiency. It is not an infection-related, we don't see any infection, but it's a mystery behind it. We don't know what caused it. But we know that people on the proper diet doing better than people who are not. But by no means we can call it a cure or even we control it yet. We leave that group of diseases to talk about the muscle disease. Muscle disease, it's probably number 2 complaint I see in my office after osteoarthritis. It aches in the joint, aches in the bone. We studied that and we find that problem with joint pain secondary to muscle is caused by circulation problem in the muscle, that the muscle is not getting enough blood, weakness in the joint, that the muscle pulls away from the joint very easy, lack of exercise, and blood clots, many problems that cause joint disease. The most important thing you can do with the joint is with the muscle is probably exercise and diet. Because we know that calcium, magnesium, manganese, and potassium, it does help the muscle. We have covered so far several joint diseases. The last one we have not covered is gout. Many of you probably think that gout is related to diet. That's what you've been told. Gout is not related to diet. Gout is caused by the accumulation of crystals called uric acid in the joint space. In the older days, we used to call it the disease of the kings because they used to eat lots of meat and lots of protein and they don't exercise. Nowadays, we realize these kings did not have, the problem was not so much meat they were eating. They actually had a gout disease caused by imbalance in their chemistry rather than related directly to their diet. Whenever you have gout, I'm sure some people right here have gout or had gout. In the United States, the main cause of gout is medication. The main causes of gout is medicine. Aspirin causes gout. Too much aspirin can cause gout. Diuretics, Lasix, hydrochlorothiazide definitely causes gout. So, diuretics cause gout. And the gout is probably one of the easiest diseases to cure because once you stop taking the aspirin and the diuretics, it goes away by itself. The most serious cause of gout is cancer. If somebody has gout, which does not take aspirin and diuretics, the doctor has to be sure there is no cancer causing the gout. What are the symptoms of gout? Gout is pain that mainly in the big toe of the foot right here. That you have pain in the big toe right here, it gets hot and red. And can we diagnose gout by a blood test? The answer is no. No, you used to think so. We used to think when the uric acid is 8, 9, that's gout. When the uric acid is 5 or 6, it's down. We find people with acute gout attack when the uric acid is normal. Because the uric acid itself is in the joint, not in the bloodstream. The best way to diagnose it, which I don't care for, we put a needle in the joint when it's hurting and take a fluid, look under the microscope, we look for the specific crystals called yellow-orange crystal, and we find it, we treat it. But we don't have to do that because it is so easy to treat it by taking the proper medications and usually goes away. But people with gout have to be sure there is no cancer, there is no kidney disease, they're not taking aspirin, they're not taking diuretic. If that is not the case, most likely then that is not gout. That is probably other things in the joint that we can deal with. The last thing I want to tell you, that to show you that to try to deal with arthritis, it becomes a very frustrating for doctors and patients. Once the physician or the patient knows there is nothing serious, you got all the time in the world to work on it. Don't ever think you're going to improve a joint overnight. It took so many years to get it that way. It's going to take half of this many years to get it better. It's not going to be overnight thing. I remember when Joyce mentioned Jenny Reed. One time she came to my office, that I think was about 5 years ago, and I was overworked, and she came and she said, you got to take a vacation, you and your family, and here's the key to my, she had a cottage up north. I think she might still have it, I don't know. And I never been in the Dells, and I took the family. I said, okay, I'm closing the office, I'm taking everybody. I met her in Howard Johnson in the parking lot that day. She gave me the key and direction how to get to her place, my wife and the kids with me. And she said, by the way, why don't you look at my dog? It's in the parking lot. Have arthritis. I remember that until today. Here I see a German Shepherd. German Shepherd, is it? The black dog? You know, the tail and all of that. I said, I sat in the parking lot using the same philosophy exactly for human being. I said, okay, this how much calcium, magnesium, this and that and that. And then she tell me after about 6 months or a year, the dog did a lot better. I don't know if the dog is still alive or not. Huh? Still alive? Well, good. So I think that's all I'm going to say about arthritis tonight. And if anybody have a specific question, I told lots of you before, I do have an assistant. His name is Dr. Percy, and he's very well trained to answer questions for me. His telephone number is 843-8860. Area code is 312. I assume all area code is 312. I know that. 843-8860, and he's there from 8 in the morning to 6 o'clock at night, 5 days a week. You can call him, and if you have any question, he will answer it. If he doesn't know how to answer it, you can call me in my office at 356-9009. This is where Medical Care Center like Villa, where I am. But you got to go through him first. If he can't answer the question, you think it's urgent, then you can talk to me, and I'd be glad to help you if I can. I'm going to take some questions from the people on this side, then the people on this side. Anybody have a question here?
What about city water? Sorry about that. City water was closed.
You know, there is a basic thing in nutrition we talked about for many years, and you remember that we said we're going to have to use common sense when it comes to our health. So when you talk about water, city water, that it has chlorine and fluorine and all this chemical, it is not good for us to drink. It is not good water to drink. Can this cause arthritis by itself? The answer, I don't know. But is this good for our general health? The answer is no. The best water to drink is probably the bottled water you can buy for drinking. That is the best water to drink. How about distilled water for drinking for arthritis? The people who spread rumor that distilled water will remove arthritis out of the body, it is a gimmick. It's not true. It doesn't work that way. But not only chlorine and fluorine and the chemical in the water, it causes probably with arthritis, probably causes other things like cancer and all kinds of other problems. So the best way to do when you come to this deciding on diet and water is to take each one of those and do the best you can in it. And if you do the best you can with water and all of that, you're probably going to achieve better health regardless what disease you have. Does this answer your question? Okay. Yes, ma'am. Muscles, see, every muscle in the body is connected to a nerve to move it. And when you have a piece of bone like this, and you have a muscle connected to it, muscles, layers of muscles, these muscles connect to a nerve to make it contract and relax all the time. We don't know why there is a problem in the nerve that's coming to that muscle from the brain to give it the message to do the job right. The word multiple sclerosis, if you break it down, multiple sclerosis, sclerosis means what? Means scars, means dryness. Multiple area of dryness in the nerve. Why did it happen? We don't know. This is why we said for last 20 years, don't wait until we get the answer to every disease. Use common sense in life, and you'll be better off. We're finding out that lecithin is an important factor in the myelin sheath. Could it be that? Maybe. Could it be infection? Maybe. Could be other things? Maybe. But we see diseases more in people who have poor diet than people with better diet. You know, we see more disease. We see more cancer in our clinic in people who are junkie eaters than people who are on a good, healthy diet. We see more depression in people who are junkie eaters than people on a healthy diet. We see more, all kinds of problems. So it is very difficult to sit down and pinpoint everyone. To make it easy for everybody, I made this thing right here, and I said, if you follow that, you're going to achieve probably a great deal of success, regardless of the problem, because it makes sense. So multiple sclerosis is one of the diseases. So far it's incurable. Affects young people. Yes, it affects young people, but people, it depends on what you call young, because a person who is 70 years old, who have a neurological disease, that's supposed to live to be 100, still have 30 more years to go, is still young. Where a person who is 40 years old, who is going to die from a heart attack at 50, that's old. So you can't really put age limit to it, because we see diseases when we get older. It's also similar to multiple sclerosis. Neuromuscular diseases, all kinds of things. So we really don't have a disease called multiple sclerosis disease. We have a degeneration of the nerve disease that affects younger women, mostly, called multiple sclerosis. Maybe down the road, 10 years from now, we're going to call it a different name. But so far, that is what we call it, and there is nothing so far we can do about it. Yes? I have been successful with lots of these patients, but I call success when you cure a person. But when you make the person's quality of life better, which I have done that, I am proud of that. But, you know, when I see patients, as a physician, I practice medicine because I love to see healing. It is not for the money. Many times we lose to practice, to keep the clinic just open, just because I love to do it. Like, for example, my other office in Hoffman Estates, Ready Aid. That place cost me 5 years, $5,000 a month loss for 5 years. And I kept it open because I had patients love to go there in the weekends at night time to get better care. We did that. I have support behind me in my family to keep things going like that. And one of the things a physician should have, I think, which I don't see lots of them have, is sensitivity to feel the pain of the stability the other person in front of him feeling during that moment. Okay? Probably that through my family and my personal experience make me feel that in that person. That's why probably it's the most agonizing thing for me is to keep practicing medicine, and I can't wait until I stop practicing because I feel better when I leave the office than when I'm in it. Because you see people like, you see multiple sclerosis patients that it is true they have multiple sclerosis, but they have anemia. They should have been, there's no reason to have the anemia for so many years. Maybe if the anemia was corrected, the quality would have been better. You follow me? One of my good friends, patients in this room, without mentioning name, I have seen her son. I think about 5, 7 years ago, 6 years ago, I don't remember. And it is true, he had a congenital problem he was born with, but that was not his problem when he came to see me. His problem, he had bled for 5 units of blood, been ignored. He had big ulcers in the stomach, bleeding. Nobody listened to him. He had severe pain in the hips and deformity and all of that. Nobody even paid attention to it. And when we corrected this problem, his quality improved. It's not perfect, but at least he's walking. At least he's doing things that he haven't done before. So when we come to multiple sclerosis and cancer and many of these patients, I have excellent success helping them, but not curing them. And I dream in the day that we find a cure to this problem, so they be free of it. But when we talk about heart problems, angina, it's easy stuff for me as a cardiologist to take a guy with blockage and improve him, or circulation problem, improve him. I'm confident I'm going to do it. Arthritis or gout. But when we talk about rheumatoid arthritis, I don't have as much confidence with those multiple sclerosis as I have with the others. That's the reason I said that. Yes? Well, I find it to help all arthritis. I find arthritis to help everybody, number one. And I have not found any problem with this whatsoever. I have seen people taking 50 tablets a day. You got to remember, what is alfalfa? What is in alfalfa itself? And once you know the ingredient of alfalfa, you respect it more. Alfalfa is a food made of vegetables, right? You take in flowers and leaves of thousands of plants and put it in one tablet. That tablet have the extract of all of these things. And if you've been around animals like cows, horses, you know alfalfa is very important to them, make their coat shiny and make them healthier. So it's got to do something to human beings. The question, can it help or not, I think it's been established through ages already, that it does help. How does it work? We don't know. We have found out that alfalfa is excellent source of protein. In 20 tablets of alfalfa, you have more protein than a glass of milk. You have as much calcium as 4 calcium magnesium. You have about 1,000 milligrams of vitamin C. You have about 400 units of vitamin E in 20 tablets of alfalfa. You have 20,000 units of vitamin A and beta-carotene in 20 tablets of alfalfa. So you're talking about a plant that is complete. It's a meal itself. I have heard things like, I've seen it published, like alfalfa can hurt patients with lupus. I have not seen it in my practice. I have lots of patients with lupus, and I have not seen that. I've seen that good diet always helps anybody. So how does alfalfa help arthritis? It does help. Itself is a diuretic. And when it is a diuretic, it gets rid of fluid. When it gets rid of fluid, it gets rid of swelling. When it gets rid of swelling, it gets rid of pain. So you can look at it from every direction. It's a good food. It is a bulky food. When you take a 20 tablets, when it gets bigger, it gets that big in the stomach. Separate the intestine, gets a better bowel movement, gets better absorption, and you have more fibers in the intestine. More fibers in the intestine removes polyps out of the intestine, help diverticulitis. So we take in one thing, going through the whole body, we see improvement in every direction. We just don't have enough time to talk about alfalfa right now. Yes? This is a very good question because I was waiting for it. The fear of cancer when you take estrogen. As a biochemist, when I find out through my work, research, that estrogen is very important against osteoporosis, and I knew that by the age of 45, the ovary dries out, I start thinking about all possibilities, the pros and cons. Let us look at estrogen itself as a hormone. What does it do to you as a woman? Estrogen, when it starts pouring out of the ovaries at the age of 11, it produces femininity in women. Makes the breast larger, the hips wider, and femininity starts. The period starts, and the woman continues to become a woman. At the age of 50, the ovary starts shrinking, and the estrogen starts going down. So to maintain the function of a person as a woman up to the age of 100, it can be achieved if we maintain that estrogen the same level all the way to age 100. You follow me? The aging of a woman only it happens in that aspect when the hormones estrogen and progesterone goes down, then she ages fast. But the aging itself can be stopped if the hormone kept up all those years. That is a benefit everybody wishes to have, and it can be achieved by keeping the estrogen level normal. You follow me? The other thing we find out from that hormone not only does something to femininity, it also prevents hair growth on the body. It prevents osteoporosis, as we mentioned before. For some reason, we don't see as many hardening of the arteries in women with plenty of estrogen as with women with low estrogen, which you know that's aging of the arteries. Women live longer than men because estrogen. One of the reasons is estrogen does that. This doesn't mean we should give men estrogen to make it live longer. Men do have estrogen, and they make estrogen. Men always produce estrogen from their testicle, and their testicle never dries up. They always produce sperm, they always produce estrogen, they always produce testosterone up to the day they die. They still can have normal life. Women can have the same thing if that estrogen kept that way. If we look at all these benefits then what do we have in reverse? That there is a fear of having cancer, having so much estrogen. This was the old theory. Is no longer, I consider it true. It is not true. Lots of doctors proven to be the case. It is not true that estrogen causes cancer. It's other causes does that. So in my practice, I do not have any woman over the age of 60, as far as I know, who has not taken estrogen. They all do. And we do have about 5,000 women in that age group. None of them have developed cancer yet in the last 6 years. So, but most of them, or 99% of them, have normal life, normal sex life, no osteoporosis, very little. They have good quality life. That's what I care about more than anything else. So the fear is there, but got to look at the quality of life of the individual, and I have to go after it. You follow me? So the reports in the medical book says it is possible that it can cause cancer. I haven't seen it, and my patients that have not developed it, and I don't believe it. You follow me? And the newer reports coming in medical literature goes now in my favor. That it is. Everybody should have used it long time ago. But I have not waited 5 years ago to give it to my patients when everybody was saying, don't do it. I said, no, I'm going to do what is best for them, which we did. Now they are benefiting from that. If the person, that woman probably have already cancer of the ovary, estrogen secreting cancer, I probably be leery to give them estrogen. But what happens when they have osteoporosis, they're going to break their hip? I don't know what to do. I probably then, when it comes to close to that, I probably then will go ahead and give them estrogen because they're going to break their hip or the fear of cancer. I'm going to have to choose between one or the other. Is this clear? Okay. Yes, sir. Mm-hmm. Absolutely. Of radiation? I'm going to tell you a story that's very fast. About 3 years ago, 4 years ago. 4 years ago, I started getting worried about radiation after that nuclear accident in New York, the 3 Mile Island. And as a physician, I didn't know much about radiation. I went to school in Chicago to get a degree in nuclear physics. When I was practicing as a physician at the same time, I go at nighttime. When I see patients, I go nighttime study nuclear physics, and that was the most agony. I can sit for 4 hours right there by nuclear physics telling me things that I don't even know what he's talking about. You know. Anyway, I keep listening. I passed the course eventually anyway, with difficulty. I learned a lot through that course. I learned the danger of radiation more, how to prevent it. I learned from this course, and I got certificates that I passed that, I'm board eligible, and all of this paper stuff in the mail. Learned something that there's more danger around than I knew. I was shocked to learn there are dumps around every city. There is no control. My teacher was telling us, which happened to be a wonderful physicist, very conscientious man also. He's a physicist, but he's so much anti-radiation. And it seems like the more you know about something, you should be that way. He was saying that in the when they had the experiment of the white sand before the end of World War II, they didn't even know a year before how dangerous is uranium. And you know uranium is very dangerous, right? And the scientists used to catch uranium in their hand and said, I don't know why my hand is burning. I think it was President Truman that time, I don't remember, it was President Truman that time, he went to watch the first success in the University of Chicago of a nuclear explosion. And he's standing behind a glass wall, and they have a piece of ball of uranium going in this this pipe, and they put it in and out, and after so many times, it creates, expands, and then it creates a little nuclear explosion in front of the president. Look at that. Look at the explosion, and the whole thing blew. Everybody in the room, 3, 4 people got killed or something like that, and the president went away. And when they did the first experiment, in Nevada, I believe, and a mushroom cloud. They had the soldiers run underneath in trucks to collect samples from the center of the cloud during the explosion and get the samples to the front to see how much radiation. Then the clouds went over Utah, and you remember the stories there, more cancer in certain places from all of that. Well, all of that through learning experience. Let's say for the peace of the world, and the war ended on all of this. Let's look at the good thing behind the whole thing. But the bad thing behind it is that we know how dangerous radiation now, but we hide in it from the public. Just one example. Those smoke detectors. What makes a smoke detector detect smoke? It's a substance called polonium. Radioactive substance called polonium. If you open it and look, it says radioactive, dangerous, watch it. Be careful. Inside it. But also says don't inside it. Don't throw it in the garbage. Take it back to the company so it can be dispensed through proper channels. How many of us knew? I didn't know that. I didn't know that before I took the course that I'm supposed to work, and then when it runs out of juice, take it to a special location to get rid of my smoke detector. And this doctor was telling us, he is a PhD professor, he said, in the dumps, everything just together, can this create reaction in every city? This radiation goes in the water, we take it, it causes cancer. Of course it can. We have to do something ourselves about, if you see something wrong, you got to correct it yourself. Don't wait for the government to do it for you. And this is, I think, what makes America the greatest country in the world, because the people correct problems, not the government. Doesn't do it for them. They make the law. So I saw a lady of mine, a patient from Richmond. I think it's Richmond, Illinois. I think Richmond, close to my clinic, is still in Illinois. And I looked at her face and looks like she's about 150 years old. But, you know, wrinkles, tremendous facia of radiation like. I asked her, how old are you? She said 50. I said, you look like 100. What happened to you? Have you noticed your face? She said, yeah, I'm wondering about it. I said, wondering about it? You should be wondering a long time ago about it. And I checked everything. I find some cancer. I started thinking, and then we started checking the area around her house. We found radiation in the soil itself. So I think the best thing to do, your question is absolutely necessary. When you have water, you can have it radioactive tested. The health department is obliged to do that for you. If you can do it, you bring it to our clinic, we'll do it. We have the most sensitive nuclear camera and the Geiger counters in my clinic. All I have to do is just pass it by. If it collects, I tell you it has radiation in it. So that's not hard to do. But the question, are we in danger from that? Yes, we are. We are in danger because when man created radiation, probably created the biggest enemy ever produced on Earth. That is a metal, radioactive, causes cancer, destroys with half-life of thousands of years. Means if you have an accident in one location, just take example, a truck passing this area with a substance, plutonium, that it has a half-life of God knows how long, thousands of years. And it's spilled in this area, that it covers 30 square miles of radiation. For 1,000 years, we can't even walk in this area anymore, just because one single accident. Of course, it's going to be hidden. But we're going to see more cancer, and we're going to discover there's something happened we didn't know about. In 3 Mile Island, there were as much radiation probably released in the air that time as the Russians had in their accident. Probably as much. But of course we hear about the Russian because of our enemy, but we don't hear about ourselves, what we're doing. And we really have to look to us, our children. Are we doing something wrong in our environment? Can we correct it or not? There are certain radiation you have to accept. I have to accept. The TV, you got to accept there is some radiation we have to live with. AM, FM radios, the radiation, we have to accept it. It's there for convenience, but we don't have to go as far as releasing more radioactive substances when we don't have to. Okay? Yes, sir. That's correct. Well, okay. As again, your vitamin E and vitamin C and vitamin B and lecithin and EPA and all of these things have antioxidant properties. They can remove chemicals out of the body. Heavy metals like lead, radiation like the gentleman was saying, which lead is the end result of radiation itself, it's a heavy metal. It's going to stay. There is no vitamin going to grab a lead and take it out. It can't. Chemically, it is non-reactive process. And mercury, heavy metals, yeah. So the body can do certain things up to a certain limit, like iodine. It's a little bit of heavy metal, but the thyroid can use some of it. But what the body is going to use lead for? There's no leaded pipes inside. There is nothing made of lead inside. Aluminum. We don't have anything made of aluminum inside. Radioactive stars, strontium, mercury. These things, man put more and more of it in the environment. It's going to seep through the air like from liquid gasolines. It's going to enter our body and going to go to the bone. When you check the blood, it will be normal. When you check the bone, it will be full of it. And the only way to remove lead, successfully remove the body, is chelation, EDTA. And EDTA has to be given intravenously, not orally. Because anybody who takes EDTA orally, it causes poisoning like rat poisoning. There are some companies now putting EDTA in tablets. If you take it in tablets through the stomach, it can cause intestinal hemorrhage that never stop bleeding. You've got to take it intravenously. And that's the only way. Are we in danger of having lead from leaded gasoline? Yes. Are we in danger of having lead toxicity from leaded pipes in all the homes and paint? Yes. Can lead and mercury and aluminum cause neurological diseases, cause Alzheimer, can cause osteoporosis? Yes, it can do all of that. Well, it depends the condition. If this is acute porphyria, that the lead poisoning, yes, that's the only way it can be helped. If that is not the cause of her problem, then the proper diagnosis has to be made then. Microwave oven, I have one, and I use it. I think microwave ovens right now are quite safe. I think the amount of, it's a radar wave, and radar wave is not as dangerous, believe it or not, as other alpha wave or beta waves, or gamma wave even. It's a different wave. It is not good to live in it, but you have microwave antennas all around us sending radar messages. It's no difference between that and the radar microwave oven. So you got to understand, there is a better way to heat a piece of bread in 10 seconds versus burn it in the oven, and I took the easy way. With precaution. I'll let my wife do it. I'm just kidding. Anybody else have any questions? Yes. Okay. Again, it seems like we get lots of good questions tonight. Rheumatic fever, contrary to what we believe, is more common than people think. Number one. It is caused by when a child or adult develop lots of sore throat, strep throat. During that time, most of recover, and some kids develop anti-strep antibody. The anti-strep antibody is supposed to go away out of the body once the infection is gone. Some people retain it. The anti-strep antibody, ASO, the strep infection is gone 20 years ago. No longer they have a sore throat, but the antibody is still there. The antibody cannot find the strep to kill. Sometimes it reacts against the valves of the heart and causes rheumatic fever or rheumatic heart disease. Sometimes it reacts against the joint and causes rheumatoid arthritis. So the answer is yes. Oh, yeah. Oh, it's easy. There are blood tests. It tells you if you ever had it, even. If you had it 30 years ago, it tells you. The blood test is very accurate for that. And then also not only blood tests, echocardiogram and the joint check. It's X-ray of the joint will tell you if the valve have ever been affected, swell by a rheumatic fever or not. By the way, this is a very important question because one of the things I see a lot when people get above 60 is swelling of the valves on the heart from early rheumatic fever. And that can be prevented, yes, with treatments. Yes. What is the chemical reaction happen when the pain goes and comes? A pain in the joint. Let's look at this as a regular joint right here. And I put a nail in it. Okay, to reduce pain. Once something comes to a joint, a foreign substance, immediately the blood, there is a release of the tissue right here, releases a substance called histamine. And the histamine brings more blood to the area, and the area starts to swell. Once the blood comes to the area to fight, the blood puts so much pressure on the nerves and causes redness, inflammation, and pain. You see that with a bee sting. A bee will sting in the body, releases a chemical, or even if it doesn't release a chemical, it doesn't matter. Histamine is released, swelling occurs, and you have to take antihistamine to block it, like Benadryl or any of that stuff. So the pain, what causes pain, what takes the pain away, there are series of chemicals called kinines released. And I know all of them, most of them, but I cannot just go through every single one. When this goes away or gets blocked, then the pain goes away. When this comes back and forth. The way your body communicates with you is through pain. That's the only language the body can let you know something is wrong. You understand? I accidentally put my hand here. There is a fire there. There is a hot plate. Immediately, the heat releases histamine, releases a chemical, goes to the nerve goes to the brain, and the brain tells the muscle pull the hand off. All of that happens in very fast reaction. That answer your question? Okay. Yes. Can you speak a little bit louder? I cannot hear you very well. As rheumatoid arthritis. I cannot answer a specific question to a specific diagnosis, specific person, but I can tell you whenever a problem happens only in one location is not systemic. Most likely there is something local rather than generalized. So you're telling me it's only in the feet, right? And it swells and blisters. It's very hard for me to believe it's rheumatoid arthritis. I think rheumatoid arthritis could be coincident diagnosis. She has rheumatoid arthritis, but not what causes what she has. It could be. You can have two different things. You follow me? You can have two different problems. Such as, for example, the lady asked about rheumatic fever. Somebody I can discover have rheumatic fever and have a swelling in the joint, but the swelling of the joint caused by infection or a nail, and had nothing to do with the rheumatic fever he had. So the fact that this is in the feet and blister, I think it could be a circulation type of a problem or infection type of a problem rather than rheumatoid arthritis. But the possibility of rheumatoid arthritis may be still there. But usually, what we see rheumatoid arthritis is in the joints of the hands first. And we have done lots of work on rheumatoid arthritis when I was under the supervision of Dr. Rothschild, one of the rheumatologists in the country, and very rarely we see it in the feet in that condition. Especially blister. Blister is the skin. Rheumatoid arthritis is a joint disease. A skin and joint do not go together very well. Are you know what I'm saying or not? You know, it seems like it's a different diagnosis she has. I think she should go to another dermatologist, or she should go to my clinic. If she come to us, we'd be glad to help her if we can. Thank you. Yes. Gold is a heavy metal, just like the gentleman saying in the back right there. It goes in and stays. Some of it is secreted through the kidney. It can cause kidney damage. I think it can be used in a short time. I wouldn't use it myself, no. I would not use a heavy metal to treat a disease that I can cause other disease. Oh, that's an easy problem then. Osteoporosis is easy. Rheumatoid is hard. And you've been taking gold for 17 years? Listen, medicine have advanced so much right now. Medications, drugs have advanced so much. There is no reason for a patient anymore to take serious drugs, where there are lots of things available that are less harmful. Okay? Gold is an older therapy. I wouldn't use it myself. Okay? Well, you might need it. I don't know. That might be the only thing will help you. But that's not the way I approach my patient. I approach my patient, like I said, through simpler pain medications, with the diet, with the exercise, with everything all happening in one time. And if that doesn't work, then I can add more pain medication and more until we get to the goal. But the goal is the end, because you have read the side effects yourself of it and the kidney, right? If you don't have any other problem besides the pain and inflammation, and you're taking gold shots that it can destroy the kidney, I just don't understand that. But the philosophy is, when you try to heal, if you're the doctor and the patient, you would not give me something that it cause more problems than I already have. And we're going to have to think about 10 years down the road, not now. We always have to do that. Penicillamine or what? Penicillamine, what were you on before that? What drug? Copramine? Fildine? That's an aspirin product. Well, fine, aspirin products are no problem. The only thing they do bad is cause ulcers. But gold causes kidney shutdown. I'd rather have an ulcer than kidney shutdown. Well, yeah, because you can stop bleeding ulcer, but you cannot bring the kidney back once it's stopped. Kidney is a vital organ. The vital organs in the body are the brain, the kidney, liver, and the bone. And the heart, of course. We can't, as doctors, try to heal something to hurt an organ. A vital organ is necessary to life. Skin is not a vital organ. It's not necessary to life. Where a kidney is a vital organ. So I'm telling you the way I approach things, we should not do anything that damages a vital organ. And the kidney is one of them. And gold will do that. You know that, right? Well, I'm worried about it too. The question here. Well, I'm going to repeat the question so you can hear what she's saying. What she had a problem in the back. They did surgery on it, and now she's getting worse. Is that simple? Okay, well, surgery in the back is infusion. Maybe the surgery was necessary that time to prevent paralysis. However, there are some kind of arthritis called traumatic arthritis. A traumatic arthritis when a person injures a joint accidentally or intentionally. Just like a football player who's having problem with his ankles all the time. Well, he keeps injuring it from football, there's nothing I can do for him. The injury is there. Or somebody is hammering his hand all the time, breaking the joint. It doesn't matter what I do, they're still going to have a problem in that joint. So, traumatic arthritis is when a man calls it to himself. Surgery is a man introduced arthritis to a joint. It could be for best to prevent paralysis. It could be for might not have been necessary to start with. Difficult to say right now. Whenever the damage is caused by a surgery, the damage can be permanent. The damage from surgery can be permanent. Just like somebody who accidentally is shot by surgery, there's no way to connect it back, usually, you know. Lost is lost. You're not going to grow another one. However, there are things to do to improve the quality of the pain in the best possible way. That is through diet, through exercise, through pain medication, combination of everything together. And when we talk about pain, removal of pain, we don't have to use drugs. There are TINS units. There are electromagnetic units. Can be used. There is hydrotherapy, there is water therapy, there is a physical therapy, there is chiropractic therapy. There's all kinds of things to be done to decrease pain. But once this pain is there, I'm a believer, you've got to get rid of pain. You can, I hate pain, I can't take pain. So I like to have any of my patients with pain. That's all I can tell you about the. We do have success with back infusion problem by strengthening the muscles of the back through certain exercising, that the muscles of the back is pushing away the effusion from each other and releasing the pressure on the nerves. That's right. That takes about probably 2 years or a year or two of continuous certain exercise. Is the result successful? Yes. The result is successful. always successful when you do the proper exercise. Just 1 second, please. Yes, ma'am. The question, can I tell her something about indocin? Indocin is an aspirin product. It causes relief pain from the joint. I consider it probably excellent pain reliever. I consider it excellent, better than aspirin or better than Motrin. The only problem with indocin is sometimes it causes ulcers and bleeding ulcer and anemia. Somebody taking any arthritic medicine that you have pain in your abdomen, aches, pain sometimes, suspect ulcer, and ulcers are very dangerous thing because not the ulcer itself is dangerous, only the amount of blood lost. You can lose about probably 1 pint of blood a week in the stool without even noticing redness in your stool. And that is very dangerous. New gout patient. Yeah, indocin, it can be given for gout pain. Well, that is the problem with indocin. 25% of patients take indocin have allergic reaction to it. And give it. Well, when you have pain, the doctor has to give you something. I wouldn't give it indocin. As a matter of fact, I only give indocin myself to young. But in gout, cortisone will be safer, prednisone, and colchicine. But indocin is a very serious drug for somebody who's not strong. You didn't think it? I wouldn't either. Can you hear it in the back? Well, Empirin is kind of indocin, but indocin is about 10 times more powerful than Empirin. So the indocin sometimes it causes that, but when you have a gout attack, if that was gout, I don't know if it was or not. If that is a gout attack, the pain from gout is bad enough that the doctor has to give you something, and he happened to give you the wrong thing for you, but 75% of the people would have responded better than you did. But now, you get to another problem, you got to answer, or he has to answer, why did you have it? Is it to be had because you're taking water pills? Is it because you're taking latex, hydrochlorothiazide, any of that? Or kidney? Or something? You've got to find the reason why it happened.
I would love to find out, because I have never been as near an insane asylum.
Well, I'd be glad to find out if it was gout or not for you. Well, I cannot work that way. When I don't tell my patient either this or that, we tell them either you have that or you have that.
A friend of ours had the same thing, was taken for gout, and he got up on his garage roof, and they had lots of time setting him down.
Well, you know, when the gentleman in the back asked me what happened, the chemical reaction of pain, the question you have there, this article made the lady almost go crazy. You know, it is the way the body defends itself against damage by releasing certain things to fight the indocin, and that's probably what saved you the way you felt. But that proves another point. There is more people getting hurt from drugs in the United States, especially aspirin product drugs, than health. The drugs are extremely dangerous over the counter or by prescription. And this is why we consider diet is very important factor in our healing. And if it fails, then we can always do surgery or take drugs if it doesn't work, just like the lady there was talking about. Good. Well, probably the best thing you can do. Good for you. Somebody, yes, ma'am. They're all the same like Indocin. Neprocin, Fildine, Indocin, Motrin, Advil, aspirin, you name it. They're all called the prostaglandin inhibitors, which inhibits inflammation of they're all indicated if the benefit of them more than the side effects of them. That's the only indication to drugs, is when the benefit from them outweighs the side effects. For example, she had arthritis, I guess, and gave her Indocin and almost killed you. You take another person who, for example, broke his leg or her hip and in so much pain, and the doctor gave her Indocin, probably indicated in a case like that, because even the side effects of that is not worse than the broken hip. So we're going to have to look at both sides of everything before we give any medication. Thank you very much, and you have a good night.
Before you leave, if there's anybody here that is not on our mailing list and wants to be, there are 2 sheets up here. You put your name and address on them. And prior to Dr. Nasr's next